I am Julian Lahrman and I work with the Moira Anderson Foundation. We're an organisation who delivers support to people who have been affected by childhood sexual abuse. We work with both adults and children, and we're based in Airdrie, North Lanarkshire, but we do limited outreach services. We offer a range of individual and group support, and we offer support, therapeutic services, and a range of groups. I work coordinator the Positive Steps project, which is a project within Moira Anderson Foundation, and through that we offer a range of self-management and health promoting services. We offer 4 elements of support, which include complementary therapies, individual support, a 12-week self-management programme called Hands-on Health, which was originally funded through the Self-Management Fund, and it's now been operating for 6 years. We also offer peer support. The 12-week programme teaches people a range of tools and techniques that they use to manage their health and their health conditions. It was developed, co-produced with people with lived experience. From the Positive Steps project, a kind of a branch of that, we also offer an outreach service called Glasgow Satellite Service. Again, that's self-funded by the Self-Management Fund, and was originally funded for 1 year in October 2019. And that was to help reduce the barriers to participation, because we have a lot of clients who were trying to access services from Glasgow, and some who couldn't come through to our premises in Airdrie. Then we went into the pandemic, so we couldn't deliver the service face-to-face in Glasgow the way we had intended. But what we did was we quite quickly adapted services, and what we could deliver virtually or through telephone, we did that. And our Hands-on Health programme was adapted and delivered virtually for the first time, and that was very successful. We were also able to offer our counselling service either through telephone or video support. And we've recently been awarded a further 2-year funding to further develop that. And the main development within that is to continue with that choice, hopefully getting back to some face-to-face delivery in the very near future, but also people will have the choice whether they access services ongoing, either face-to-face or virtually. I think that's just a very quick whistle-stop tour of what we do at MAF, the Moira Anderson Foundation. So thanks for listening.
My name's Maggie. I work for a charity called Badenoch and Strathspey Community Transport that's up in Highlands, but our charity was set up about 23 years ago. We've been on the go some time to try and find solutions in a rural area to get people access to services. So we started up a voluntary car scheme with volunteers using their own cars, and we had volunteer telephonists that took calls and directed the support services, through the volunteers. So that started off, and that grew into other areas where we are. We started at a pilot, but as these things happen, everybody needs transport. Everybody needs to get from A to B. So it actually grew into other services as well, which we do. We've got accessible vehicles now that we own ourselves, 2 minibuses and a car. And we provide assisted shopping services to support that, because the majority of people that we help are perhaps older people and people with mobility issues. So there's quite a high percentage of over 65s living in our area, and with each village being quite dispersed from main roads, public transport being very poor, it is difficult to get from A to B. And So a lot of the services that we do actually enable people to remain at home for longer and allows them to be independent. So as I say, the shopping service was added to the normal car scheme runs, the assisted shopping. That was very, very good. We started befriending services, lunch clubs, supper clubs, support groups, anything, but transport is the enabler, if you think of it as the hub of everything, but all the social inclusion things that are round about it. Some of them we manage, some of them we link up with other groups. But all in all, it actually allows people to remain independently at home for longer. So we work with feedback from volunteers, feedback from clients all the time to develop the services that we need, and access to services what older people and disabled people need. So we're all one big, huge family, clients, volunteers, service users, and we just collaborate with lots of other organisations as well, and public sector too. So that's how we operate.
Cardiomyopathy UK is the patient-centred, patient-led charity for heart muscle disease. We cover the 4 main cardiomyopathies, as well as a smaller number of more rare heart muscle conditions. Almost every patient suffers from the symptoms of heart failure, breathlessness, fatigue, fluid retention. Many develop arrhythmias and atrial fibrillation, and we're continuously learning more and more about the genetic aspects, either as a direct cause of the disease or indirectly giving rise to a greater sensitivity to environmental factors. So our work means that we operate in 3 worlds: the world of genetics, arrhythmias, and of heart failure. Well, what do we do for our people? Above all, we provide support and resources for patients and their families. There are peer-led support groups, and in the original model, they meet face-to-face in locations across the whole of the UK. But of course, since the pandemic and since we learned to use Zoom, we now have 38 groups meeting, many actually condition-specific. So as an example, in June, we had focus groups around devices, advanced heart failure, genetics, cancer and cardiomyopathy, ARVC, and in addition, 8 of the geographical groups were meeting. So quite a lot of activity. We provide peer-to-peer support through our hospital clinic service, although needless to say that that had to stop last March and hasn't yet restarted. But as a result, our telephone peer-to-peer support folk have been busier than ever. And so too our cardiomyopathy nurse helpline, which runs every weekday. And that saw a 300% increase in calls at the start of the pandemic, largely because clinics were being cancelled. And of course, there was so much concern over the vulnerability and shielding questions. We've also got a very popular and valued welfare and claims service, which has had extraordinary success, helping claimants previously rejected for things like PIP. Now, we work to educate healthcare professionals and to provide them with the patient's voice. We collaborate with others working in the same field as us, so we're members of the Genetic Alliance and the Scottish Heart Failure Hub, just as examples. And recently we've been building our capacity to encourage policymakers and commissioners to improve access to quality treatment. In March, we sent out into the wide world 14 trained change makers as patient advocates. They'd been trained up, and their role is to take up positions of influence at every level, from primary care through secondary care, and some of them are now working with professional bodies. And they're tasked to promote our 16-point patients change agenda. So this is a charity which is led by trustees like me who have, experience of the journey, and it's committed to working across the whole of the UK to ensure that everyone with cardiomyopathy gets to live longer and fuller lives. Thanks.
So my name's Carolyn and I'm a Deputy Charge Nurse at the Outpatients Department at the Prince and Princess of Wales Hospice in Glasgow. And what I was going to talk to you today about is a new service that we've developed, that we had began to develop just before the pandemic. The pandemic hit and it shut us down. But actually, on hindsight now, the pandemic lent itself well to us to develop this service, so that now that we're coming out of it, we actually have done all the background work and paperwork involved to allow us to actually sort of start this new service. So what it's called the Living Well Hub for our outpatient patients to come to. And prior to the pandemic, we used to offer something at the hospice called day services, which I used to work in the inpatient unit. I got moved up to the outpatient unit on a secondment, and I'm now still here. And but what was recognised as day services wasn't really what we wanted it to be. We wanted it to be a lot more vibrant, a lot more flexible for people. They've got more options. So what we've developed is hopefully what the title says, we're helping people to live well for however long they have left. Obviously, all of our patients attending a hospice, they've all got a life-limiting illness at varying stages of their diseases. We see patients that have malignant and non-malignant illnesses. Prior to the pandemic, we were able to commence this Living Well Hub for 5 weeks. So it was literally in the very early stages. Pandemic hit, but now that over that time, as I say, we did all our risk assessments, we did the standard operating procedures, we put all the paperwork in kind of scoping stuff. We did all of that, and last week we launched our Living Well Hub for the first time since coming out of the pandemic, because we were then moved into level 2, so we're allowed a small proportion of patients to come in the building. We did offer some outdoor activities prior to that. What our focus will be is that whilst patients are here, there'll be 2 days a week that it'll run. At the moment, we aim to hopefully build on that, but within those 2 days, there'll be 4 sessions. So there'll be a morning and an afternoon session. So Wednesday morning, Wednesday afternoon, Thursday morning, Thursday afternoon, and it'll be each of them, the sessions will be 2 hours long, where they'll be able to have peer support and meet other patients in similar circumstances to themselves. They would have access to the physiotherapy, the occupational therapist. They'll have nice things like we've got a lovely hair salon here. We've got complementary therapy, and what we're aiming to have is every session will have some sort of group work that is available if people want to join in, and we aim that to be maybe more a kind of gentle yoga, a bit of mindfulness, a relaxation session. Because we are in the early stages, we're very lucky that we can then kind of shape it around what the feedback we get from patients. So if for example, if someone was to say, I wanted to know a wee bit more about nutrition, I want to be following a bit of a healthier diet, then I would liaise with the chef in our kitchen here that'll maybe come round and do a session on sort of healthy eating, nutrition, maybe do a sort of example that we want people to learn to take home. So they maybe do a session on, making smoothies, but actually practically people can do that in their own home and they'll take what they learn away with them. It's the same with the relaxation sessions. They'd be able to do that at home if they're suffering from anxiety or worrying at all. In addition to that, I will run out once a week a clinic where they'll all get a nurse review. I will offer our patients a once a month review. I'll run it once a week, but every patient will get a once every 4 week nurse review for any sort of symptom management issues, whether it's pain, nausea and vomiting, shortness of breath. And obviously if there was issues in between times, I would be at the Living Well Hub that they could approach me if there was something in between times.